Today we'll discuss the history of cesarean sections across different civilizations, the first successful cesarean, and why the term Cesarean is used, not because of Julius Caesar. Stay with us. 1. Ancient civilizations. Egypt. The ancient Egyptians were advanced in medicine, as evidenced by medical texts like the Ebers Papyrus around 1550 BCE, which contains information on childbirth and gynecology. While there is no direct evidence that they performed cesarean sections, their knowledge of surgery and anatomy suggests they might have had methods for dealing with difficult births. Greece and Rome. Greek medicine. Greek doctors like Hippocrates 463–70 BCE wrote about childbirth procedures, but there is no clear record of them performing cesarean sections on living women. In mythology, there are stories of gods being born from the side, which might hint at early surgical birth attempts. Roman law. In ancient Rome, the lex Caesarea, around 700 BCE, mandated that if a pregnant woman died, the baby should be removed from her womb. This law indicates that cesarean sections were initially performed only after the mother's death to save the child. The story that Julius Caesar was born via cesarean is not true, as his mother Aurelia survived childbirth, making it improbable that a cesarean was performed. India. The ancient Indian text, Sushruta Samhita, written by the surgeon Sushruta around 600 BCE, describes various surgical procedures, including abdominal surgeries. Although it doesn't specifically mention cesarean sections, it shows that ancient Indian medicine was capable of complex surgeries. Indian mythology also includes stories of divine births through surgery, suggesting an understanding of the concept. China. Traditional Chinese medicine relied on herbs and acupuncture to assist with childbirth. Ancient texts focused more on natural birth, but later records suggest that they had knowledge of procedures similar to cesarean sections. Like other civilizations, these were likely performed as a last resort, often after the mother's death. 2. Medieval and Renaissance Europe. Medieval Europe. During this period, cesarean sections were typically performed after the mother's death to save the child. Without anesthesia or antiseptics, these procedures were very dangerous and often resulted in the mother's death. The Catholic Church supported cesarean sections after the mother's death to baptize the child if the mother died during childbirth, highlighting the role of religion in these practices. Renaissance surgeons. With the Renaissance came increased interest in medicine and surgery. One of the earliest records of a successful cesarean where both mother and child survived was in Switzerland around 1500. Jacob Neuffer performed the procedure on his wife after a difficult birth, and both survived. This case is debated but considered one of the first indications of a successful procedure for both mother and child. 3. Early modern period 17th to 19th century. Surgical developments. In the 17th and 18th centuries, understanding of anatomy and surgical techniques improved, but without anesthesia or antibiotics, cesarean sections on living women remained very dangerous. By the 19th century, the introduction of anesthesia like ether and chloroform made surgeries less painful and somewhat safer. Joseph Lister and aseptic surgery. In the late 19th century, Joseph Lister introduced antisepsis in surgery. Using carbolic acid to sterilize surgical tools and clean wounds significantly reduced infection risks and made cesarean sections safer. This period also saw the development of the Kerr incision, a horizontal cut in the lower uterus that reduced complications in future pregnancies and became the standard technique. 4. 20th century to present medical advances. The 20th century brought rapid medical advancements, including antibiotics and blood transfusions, which reduced maternal mortality associated with cesarean sections. Elective cesareans became more common with improved prenatal care, allowing doctors to anticipate problems and plan for surgical deliveries. Technology like ultrasound helped in diagnosing issues such as breech presentations, influencing the decision to perform a cesarean. 5. Current era and debate cesarean rates today. In the 21st century, cesarean sections are among the most commonly performed surgeries worldwide. However, the increase in elective cesareans has sparked debates about their necessity and long-term effects on maternal and infant health.